Normally, we check in with infectious disease doctor Zain Chagla for updates on COVID. Not this week. Everyone is talking about a new virus, monkeypox. Good morning.
Hi, good morning.
So what is monkeypox?
Yeah, just when we thought it was time to rest.
Yes.
So monkeypox is an infection that's actually been around for some time and has been circulating in quite high numbers in sub-Saharan Africa and Nigeria and the Democratic Republic of Congo. There's been spillover events that have occurred in North America and the UK from either travelers or a few years ago from domesticated pets that were imported. But this is different. This is showing up in clusters in the United Kingdom, throughout Europe, and now in Montreal. This is a virus that typically causes a sore throat, fever, and then progresses to pox lesions. So these pustules that get all over the skin. Very similar to smallpox. It's a related virus, but much, much milder in that sense. And so we're seeing this now. We're seeing this in predominantly men. Although, again, it's very, very early days and the outbreak investigations are still underway. And we're seeing it in people that haven't traveled and don't have kind of the animal exposure that we would expect. And so there's a lot of questions of whether or not this is from more international travel. This is from waning immunity, as people who had smallpox vaccines had some protection against this. Or is there something else different, a behavioral change or a viral change that's leading it to spread in these communities?
So, I mean, as we've seen with COVID, could it have mutated or be a variant?
Yeah, absolutely. I mean, the genomics are looking like it is coming from West Africa, very similar to the other events that have happened from Nigerian travelers and others. The one difference here is that it is presenting in Montreal and in the UK and Europe in a number of men as almost like a sexually acquired disease. It is causing genital lesions. And in fact, some of the initial doctors that made the diagnoses were working in sexual health clinics. So that's a bit different. Usually the lesions are on the face, the arms, and the trunk. This is showing up predominantly in the genitals. And so, there may be a different pattern of transmission here that's starting to show up, which may be the virus or behavior or a combination of the two.
Okay, so we want to tell people don't panic. It's not something that looks, or at the moment, it doesn't seem like something that could be airborne. It seems to be more contact or maybe fluid contact.
Yeah, I mean, smallpox and monkeypox can travel in the airborne route, but it's much less likely. Most clusters that have happened over the last few years have been very close contacts, people who got it, people around them who were in direct contact with them, like partners, and going from there. And the good thing here is that we do have effective strategies. So there's decades of knowledge around this disease, around contact tracing. It's a disease that shows up very late after its incubation period, so you can actually isolate people to try to break chains. And we have smallpox vaccination, which is being used in the United Kingdom right now, which around those contacts of people that have been exposed may reduce the risk of getting the infection and then subsequently stop chains of transmission moving forward. So we have more tools here. We have a lot more knowledge than COVID-19 when it started. And so, this is something that hopefully will come under control after a few generations of the disease.
Now, how does that differ from chickenpox?
So chickenpox is a different virus. And really chickenpox, as it shows up, when people get chickenpox all over their body, the marks or the pustules tend to be, there's a few on your face, then they crust over, there's a few on your arm, and then they crust over, kind of different stages, different phases. Whereas monkeypox, all of the lesions kind of show up slowly at once, and they're kind of at the same stage as they go through. They last a bit longer. Chickenpox, things crust over in a few days, whereas the lesions here can last 2 to 3 weeks for some individuals. So it is a little bit different, but this is for providers in the community who are seeing patients with chickenpox. It is one of the things to keep in the back of their minds to say, could this be something different in that sense, especially if it's starting to look very different.
We have all become experts on viral diseases now, haven't we?
Yes, exactly.
Sadly. But I mean, maybe that's raising awareness, right? That's what another lesson of COVID.
Yeah, exactly. We're all connected. There's a global health background to all of this. And again, pandemics are going to be a part of our future as we kind of become very connected networks.
Okay, well, thank you for connecting with us as always every week, Dr. Zain Chagla. A pleasure to speak with you.
All the best.